Well, good morning, and it's great to have you with us this morning, Vinny. We have with us today, we're very honored actually to have with us today, the Director of Tarrant County Public Health, and that would be Dr. Vinny Taneja. And Vinny has been with us how many years?
Almost 8 years.
8 years. It seems like yesterday.
Yes, sir, it does.
The Ebola.
That's right.
The Ebola event, and I think you started a day before that.
Yes, sir.
Or 2 days before that. So you were came here from Detroit, if I remember.
That is correct.
County.
Wayne County. Wayne County.
Wayne County.
Yes, sir.
Okay. And so we were very fortunate to be able to bring you into our fold here at Tarrant County. Tell us a little bit about what current public health related concerns are there out there for seniors, and what precautions can they or should they be taking?
Well, first of all, thanks for having me here this morning, Commissioner. So the big concern right now, it's rare, but we're in sort of mid-March and we've got a major flu upsurge going on, late season. So the big thing is seniors need to be aware that flu is out there. And if you start to get respiratory symptoms, of course, COVID is on everybody's mind, but do get a test for the flu. Based on the current numbers, we're seeing almost 20% of the people who are getting tested coming back positive with the flu, and only about 3% come back with COVID. So flu is more currently a major problem in Tarrant County. So the thing to remember with flu is, of course, y'all should have had your flu shots by now. We're in March. Seniors get the high dose shot back in August, September. But if you still get symptoms and you come back positive for the flu, first thing, get your doctor to put you on some kind of antiviral medication like Tamiflu. There's a couple of good ones. Tamiflu is a good one, and there's another one called Xofluza. That's a single dose. These medications tend to reduce the severity of illness, prevent from getting hospitalized or further sick. So that is the big key. And then second part, of course, we're still in COVID season. That's been our life for the last 2 years. So seniors do need to remember that COVID is still out there. So take all the precautions related to that when they're out and about. Okay.
Well, that's very good to know about the flu. Hasn't gone away.
It has not.
Just the regular old flu we deal with on a yearly basis. So,
yes, sir.
So let's talk a little bit about COVID. Do seniors need to take what we call the fourth booster?
So
if they've had the third booster?
Yes. So there is now the way the fourth booster works. So the way most vaccines work currently, we have the Moderna, we have the Pfizer, and we have the Johnson & Johnson. Moderna and Pfizer are typically a 2-dose series, and Johnson & Johnson is just a single shot. But over time, they realized that the efficacy of these vaccines start to decline with time, so they came up with a third dose, and then later a booster dose. And originally, the third dose was recommended only for those that are severely immunocompromised. So people that have, active cancer, they're on chemotherapy, or some kind of immune suppressing drugs, they've had transplants, they've had other issues. Those folks get the third dose. Everybody else gets the booster dose. So the question is for the seniors, do they need the fourth dose? Generally, no. But as with seniors, you understand there's a lot of health conditions. So talk to your healthcare provider to see if those health conditions qualify as immunocompromising, and that's when you get the fourth dose. So the way the series works right now, you get Pfizer, for example, and then 3 weeks later or 21 days later, you get your second dose. So if you are immunocompromised, it is recommended you get your third dose another 28 days later, like a month later. And then if you qualify for that fourth dose, you would go out about at least 3 months out from there. So it gets a little complicated depending on which vaccine you've taken, but a lot of seniors took the Pfizer, so I gave you that example.
Yeah. Well, that's, I guess, being immunosuppressant, that's something that if you feel like you are or you know you are, you need to talk to your healthcare provider
Yes.
And if they recommend it, then I guess.
Absolutely. And it's widely available. There's no shortage. There's no lines anywhere. You can go to any pharmacy. They should have it. And call ahead because, sometimes they run out and then they, tell you go somewhere else. So I would call ahead before you go to a pharmacy, or you can come to a health department location. We have about 5 clinics that constantly have the vaccine available, and there are regular brick and mortar public health clinics. But we still also do a lot of pop-up clinics in the community. So we work with churches, we work with community centers. So look up, or call our hotline to find out where we are in your area, and you can get your booster dose done there as well.
Okay. So, well, it sounds like me here. When seniors travel internationally, what precautions should they take?
Yes, that's a very good question, Commissioner. First thing to know is there a travel advisory related to health at the destination? Currently, COVID is still raging in other parts of the world. Recently, we've seen a lot of activity pick up in Europe. A lot of seniors do travel to Europe. And then, of course, there's activity really high in New Zealand right now, in China right now. So a lot of these destination spots, even places that tourists visit, Solomon Islands, for example, has a high COVID outbreak.
Right.
So the state department website, travel.state.gov or something, they have a advisory on each of the travel destinations. So first thing is to look at that to see if there's any restrictions out there. And then secondly, you can certainly visit a travel health clinic. Public Health Department has one at 1101 South Main Street, usually by appointment. So seniors can come there and get advice on other things. Some places have malaria problems. Some places the water may not be clean. So our nurses will give you that advice and some prescriptions if needed. If there's any shots that you need to catch up on, like a yellow fever or something of that sort, they will take care of that as well. But we're not the only travel health clinic. I think there's about 11 in Tarrant County as far as I know. For some time there was a Walmart nearby that was actually doing some travel health, but I don't know if they've continued with that. So certainly look up, there's a company called Passport Health. They do a lot of travel health clinics in the area, especially like in Grapevine area. So that's another place I would suggest that seniors visit and get all their travel health information. And then finally, you want to check with your airline that you're traveling with, because a lot of places do have entry requirements. You must be vaccinated, or you must have gotten a test before you board a plane. And some of those are time-limited things. So you would want to work with your airline to see what the requirements are, and then get those done in an appropriate time frame, because otherwise they'll reject at the airport, oh, this is more than the time frame that we needed. So some of that complication is still there in travel arrangements, but if you're planning a big trip, what's one more thing?
One more thing.
One more thing.
One more thing.
Yes, sir. Yep.
Okay. Do you have anything else you'd like to share with us?
I do. We're 2 years into COVID, and currently in Tarrant County, we're in a good spot. Things are very, very low. So I don't want people to feel like, it's all negative news and I need to just sit at home and do nothing, because what we're seeing is a lot of pressures on mental health. People are, in literal terms, going stir crazy staying at home, right? So we want to make sure seniors do get out, get some exercise, take a walk, go visit with some friends. But again, since there's an active outbreak of COVID, even though things are low, take some precautions. I mean, if you're going to a large group gathering, it doesn't hurt to put on a mask. You know your health, right? I mean, if you're generally healthy and you're vaccinated, okay, you can be more liberal about how you deal with things in a large setting. But if you have health conditions, which a lot of us do, take a little bit of extra precaution, put on a mask or maintain a 6-foot distance. You don't want to come home from a large gathering and a few days later get sick. So that's one thing. The other thing is, because of COVID and how healthcare changed and a lot of things were closed and then they were open and all this happened, staffing were short. A lot of people missed their regular healthcare appointments. So we're finding that, blood pressure is going uncontrolled, diabetes is going uncontrolled, heart disease is not looked at, cancer diagnoses are being delayed. So all of that seniors need to be very mindful of. Go visit your doctor. Do not miss your doctor's appointment. If you have a problem getting in, a lot of them can do now a telehealth visit where they can visit with you on the phone or on a screen, like on an iPad. So I would suggest that seniors pick up that pace of getting their appointments done so we don't miss anything major. And just get out and get some exercise done. The weather's getting nice. We don't want people to sit at home and collect diseases. We want them to be healthy.
Okay.
All right.
Hey, we really appreciate you being with us here today, and we're going to be broadcasting this on our website, and we're going to do some e-blast where we'll put this out, and we'll also have it on our Facebook site. So if somebody says, "Hey, I saw you,"
I do get that occasionally. Yes, sir. You were that guy. Yes, I am.
You're on television more than anybody, right? Here in the last 2 years.
I'd rather go home and sleep.
I know. I don't envy what you and Judge Whitley have been going through.
Yes,
well,
sir.
listen, thank you very much.
Thank you. Thank you for having me.
Appreciate it.
Appreciate it, sir.
You bet.